So remember we talked about all those different stressors, the different stressors that we have. And so here's the biggest thing is this is where guys want you to participate, right? Because when you leave here and you're like, that was really good, awesome. We just got a great spa type of experience, and we all felt really good. We all rallied the troops. And then, a month from now, if I said, hey, how's your life? You're like, I'm still stressed. Well, then all we did is just had an awesome powwow and felt really good. And I want to actually change people's lives. And today is going to be a little bit more functional as far as things that you can actually do in order to start helping specifically with that mental stress. So in baseball, if a pitcher pitches a pitch right down the middle, right at the knees, and it crosses the center of the plate, is it a strike? It depends. It depends if the ump calls it a strike. Does that make sense? So the ump will call it a strike, or he'll call it a ball. And it doesn't matter if it's actually a strike or not, because it just depends on what the ump wants to call it like. And this is the same thing when it comes to stress, is that it's only stress when you call it stress. Does that make sense? Because I could stub my toe in the morning, and I could say, yes, I'm alive. I feel pain. This is amazing. Or you could stub your toe and you're like, well, I knew it. I knew I was going to have a bad day. See, this is proof. And I'm just going to wait for everything else to be bad and everyone's going to feel sorry for me. So it just depends on how you want to see it. There's nothing that happens in your life that is stress. Everything is an event. And you get to decide if this event is going to be stressful or if it's going to be not stressful. An event. Everything is an event. If your dog dies, it's an event. What do you mean? That's really bad if my dog dies. Well, how are you going to deal with it? You're going to say, oh, woe is me, my dog died. Everyone feels sorry for me. Or you could say, you know what? My dog died. It was his time, and you know what? I had so many good memories, I'm going to cherish those. It just depends on how you want to look at it. Here's the rules. Rule number 1. Not every event is a grizzly bear. All right? Ladies especially, not every event is a grizzly bear. Stop having a grizzly bear response to everything. Does that make sense? So my wife is amazing at doing this because, for example, I'm going to tell you something. Right now, if you go to my house, it's empty and there's a bunch of boxes. You know why? We're moving. So right now in my life, we're moving from one house to the next. My wife runs a consignment sale for children's clothes. She has that next week, which is super stressful. So we have all these little things that have just come together like a perfect storm, but we actually just choose to what? Not a grizzly bear. So you get to choose whether it's going to be a grizzly bear or not. It's not a slam on ladies. It's just how you're built. And I'm going to give you a perfect example. I was talking to my wife about this the other day. My son's like, Dad, can I ride my bike to so-and-so's house within the neighborhood? I'm like, yeah, go for it. Have fun. She's like, wait a second, don't you understand? I'm like, what are you talking about? She's like, when a man says to their son, go ahead and ride your bike, and in fact, go ahead and cross the train tracks, you'll be fine. And a woman says, what about the train? What time does the train actually cross the tracks? What happens if they get a flat tire on the train tracks? What happens if their foot gets stuck crossing the train tracks? She says a man just looks at one thing and a woman looks at 20 of things that probably with a 99.9999% chance that will never, ever, ever happen. She says, you don't understand. We worry about every possible outcome. And it's true. So you got to stop worrying about the 0.0000001% is actually happening. That's a great question. But biochemically and hormonally, yes, we are 100% different. Don't let anyone ever say that men and women are the same and that men and women can handle the same amount of stress. They can't. Just biochemically, they can't. And it's time to actually appreciate our differences rather than actually trying to say that we're so much similar. So, number 2, be an anchor and not a flag. So, an anchor is something that never moves, and it's not dependent on anything. Once an anchor is set, it is unmovable. But a flag blows when? Or how does a flag blow? It depends on the wind. Where's the flag blowing? It depends on the direction of the wind. And this is most people. Most people are flags because your day is dependent upon your circumstances. Makes sense? So how do you become an anchor and not a flag? Because when people say, what does your day look like? It looks pretty not a lot of emergencies, and it's just pretty like day to day, because you have to work on becoming that anchor, not a flag. Here's what I mean by an anchor. An anchor is this. An anchor means that you have priorities. And your priorities determine your day, not your circumstances determining your day. So what I want you to do is I want you to write down what your priorities are. You have that sheet, write down your priorities. Now, I don't want you to write down what I think your priorities should be. I want you to write down what your priorities. I'm not judging you because you don't have the set of, well, it's God, family, others, this, and this, and I'm like, no, it's not. I want you to truly write down what your priorities are. And it's okay to have a priority as, I don't know, I like to watch The Bachelor. If that's a priority, then write it down. I don't like to watch The Bachelor, but I'm just saying. So, in fact, and if you have to think about it, then you got a problem. You should know my priorities are this, and this. And so how do you become an anchor? An anchor looks at the priorities and works on them how often? Every day. All right? So what are your priorities? All right? Now, here's the question. How much time did you spend on each one yesterday? And you're like, oh. So take what you actually spent your time on yesterday and look at your priorities. And if those don't match up, what is that? That's called being incongruent. And you guys realize that when you're incongruent, there's a whole level of stress with that. Because if you say, my priorities are God, my family, my career, my health, and yesterday, what you did is you slept in and you never worked out and you perused Facebook for 3 hours and then you went to Little Caesars and had 2 pizzas, and those are not this is actually your priorities. So over here you have what your priorities are, and when do you work on them? You work on them every day, every single day. Does that mean you give each one equal time? No. Sometimes it may be that you're spending the whole day with your family. Some days it may be you are only spending 15 minutes, but you're always working on those priorities every single day, and you don't go to bed until you've worked on those priorities. So those priorities don't actually have equal time, but you're also not neglecting them for weeks and months on end. If you really say that health is your priority, then work on your health. Do something with your health. It goes back to the idea of broccoli being a good idea or actually doing it. Okay? So how much time did you spend? How many of you are like, oops, okay. All right, so I'm more of a flag and I'm not an anchor. Because if you said I didn't have time to work on my priorities, what are you? You're a flag and you're not an anchor. All right? Number 3, learn to say no. Learn to say no. All right? So what do I mean by learning to say no? What does that mean? That means you are creating boundaries. Those are boundaries. Well, how do you know what to set boundaries on? You have priorities, and you have boundaries around those. If you never have priorities, you'll never set boundaries. So what I mean by saying no is I mean you say no to things that aren't part of your priorities. Because here's the thing. If you never draw boundaries and you never say no, guess what? People will continue to walk all over you until you break. And if you never set a boundary, someone else is going to set your priorities, and they're not going to have your best interest in mind. So you have to be able to set boundaries. And this is the problem, because how many of you get angry with other people? Because they're constantly going into your boundaries, and they're crossing over those lines, and you get mad at them. You get mad at those people? Guess what? How can you be mad at them? You never told them. And so there's so much dysfunction with people because people think you should know my boundaries. No, they don't. They're never going to know them until you tell them. So those boundaries have to be communicated. Now, when you start, some of you need to go home and start saying, I'm setting a boundary on this, but because you never set a boundary starting off, you know what's going to happen? That person's going to do what? They're going to act like a child. Because when you give a boundary to a child, what do? Cry, whine, complain, whatnot. Now, adults aren't going to do that, but you know what they're going to do? They're going to do a version of it. They're going to be angry. They're going to give you a cold shoulder. They're going to talk bad about you. They're going to do those things, but it does not matter. So when you draw a boundary and the other person has a problem with it, whose problem is it? It's theirs. It's not yours anymore. But it doesn't mean that you have to be a jerk or you have to be arrogant about your boundaries. So turn to the person and say, ask them something. Hey, do you want to go out for coffee afterwards? Turn to the person and ask them that. Go ahead. Turn to the person and say, you want to go coffee afterwards? And then say this. No, thanks. And that's all you have to say. That's all you have to say. No, thanks. Because I have to tell people no all the time. Because it's not my priority. And I realize that people will continue to push until they start pushing out my priorities and they start living their life through me. But I always say this, be a gracious person. Be a very gracious person. But other people don't get to dictate how you're going to be a gracious person. Does that make sense? So how do you know whether to say yes or no? I came up with this like a year and a half ago. How do I say no to this or how do I say yes to this? Yes or no? Should I do it? Number one, will it move my priorities forward? Should I do it? Do you know your priorities? Will it move my priorities forward? Number two, will it help others? Number three, will I enjoy doing it? Just think about it. You should enjoy life, right? So I always say, if it's 2 out of 3, then let's go ahead and do it. And let me give you an example, okay? Let me talk to you about exercise. If I exercise, will it move my priorities forward? Because exercise is a priority. Will it help others if I exercise? Actually, yes. Because the better shape I am, everyone gets better. Will I enjoy doing it? No. So 2 out of 3? Yes. Let's talk about me mowing my grass. Will it move my priorities forward? No. Will it help others? No. Will I enjoy doing it? No. Do I mow my grass? No. Now watch. My son mows my grass. Will it move my priorities forward? Yes, because my family is a priority and the development of his character is important to me, and when he works, he develops his character. So yes. Will it help others? Yes, I pay him. Will I enjoy doing it? I get a lot of enjoyment watching him not enjoy mowing the grass. So you understand, because maybe some of you are doing a lot of things that don't really matter. Now watch this. Helping Dr. Nate move. Will it move your priorities forward? No. Will it help others? Yes. Will you enjoy doing it? No. So don't do it. Wow, this really works pretty good, doesn't it? All right. And then number 4, don't be a micromanager. Don't be a micromanager, all right? I know, these are some funny things. What do I mean by a micromanager? Hey, you're stapling that weird. Let me help you, show you how to staple this. You know what a micromanager is? Someone who doesn't know how to let go, who needs to be intimately involved with everything because they have a fear of losing control. Guess who's a terrible micromanager? Guess who's a reformed micromanager? Me. In fact, ask Kelly. Kelly, before you leave, because she's been working for me for 7 or 8 years. I can't even. And ask her when she started. Ask her how I was. She said terrible. He was a terrible boss. He was looking at everything, trying to manage everything. And do you guys know? I have no idea what happens up at the front desk. No idea. And people say, I have a question about my insurance. I'm like, I have no idea. I have no idea. Do you have insurance? I don't even care. I don't work with it. I am the person who is in the back, focus on what I do, and they are actually doing, and I give them tremendous amount of freedom. And I have a question about this, and I said, tell me a solution. And they say, all right, well, I would do this. I said, sounds pretty good. Or I say, I wouldn't do that, but I see where you're going from. Here's what I would do a little bit different. So I help them figure out how to solve their own problems. But I don't micromanage it. How many of you micromanage your kids? How many of you micromanage your job? You micromanage everything, and it's absolutely exhausting. You have to be willing to let it go. And just focus on the outcome, not how people are getting there. So you have to stop being a micromanager, because here's the thing. Not only does it stress you out, but guess who else it stresses out? The person you're micromanaging. So you're doing them a tremendous disservice. And then number 5, here's the 5x5 rule. All right, 5x5. Name something that you stressed out about this morning. Getting here. What did someone say? Like the traffic. Stressed out about the traffic. All right, here's the 5x5 rule. If it's not going to matter 5 years from now, don't spend 5 minutes worrying about it. If it doesn't matter 5 years from now, don't spend 5 minutes worrying about it. And this is why the development, your personal development, is so important. Because if you're not working on yourself, then you quickly you become like you're behind your stress. Like your stress is always outrunning you. Now, for those of you who just choose to be sassy and not listen to anything that I have to say, remember how we said about bailing out the boat, but first plug the holes? Well, this is a great start for people who have a high amount of stress. And this is the reason why. Number one, you look at kava, okay? Why kava? What's our purpose of why someone would have kava? Kava is mostly for people with like depressive type symptoms. Okay? So if someone says, I'm trying to get off an SSRI or whatnot, we'll start giving them like kava in order to kind of maintain their neurotransmitters while we're fixing on some of the causes. Now, CBD, despite what everyone says, it will not help you regrow a limb, all right? Because, everyone's talking about and you guys know the CBD is the flavor of the day. You guys realize that. Just like exogenous ketones were the flavor of the day 2 years ago, or that essential oils were the flavor of the day 3 or 4 years ago. And it's not to say those things are necessarily bad. It's just say that the benefits are what? Are often overstated. Because everyone says essential oils are going to save the world, and no, they're a tool. Well, CBD oil saved the world. No, but here's why people should be taking CBD oil. CBD oil is actually going to be great in order to calm down the sympathetic nerve system, specifically when the sympathetic nerve system is like this due to chronic inflammation. Okay? This is why CBD oil is so good for people who have had a head injury, for example, because it's really good neurologically. Now, California poppy, which some of you had, this is actually going to help for like things like with anxiety, so people who are very anxious or they need their sympathetic nerve system, this to calm down because of a lot of mental type stress. Okay? So what do you think that I take? Do I take this? Yeah, I do take it. Because sometimes I come into the office and I'm like, Lord, I have no idea how I'm going to do this today. Whoop, tip it back. The other day we had 15 people waiting here to get adjusted, and someone said, aren't you nervous? Or aren't you really anxious? Like, I don't know. I'm like, I don't know. Should I be? And I looked out there and I'm like, nah, not really. I had California poppy. So, all right? Now, what's alcidonia? So remember we talked about the two portions of the adrenal glands? You got the cortex and then you got the neurological. Alcidonia works with the neurological. This is why it's got things like passion flower. It's got 5-HTP, which is a precursor to serotonin. And it helps with that norepinephrine, adrenaline. It helps if they start to get a little bit too much and these neurons start to get tanked, it helps to replenish that. Okay? So is this are these life changers? Well, for some people they are. But you got to remember, like, these things are just a tool that we use, but what do I want you to do first? Like, if you're willing to plug the holes, then yes, these are going to help you. If you're not willing to plug the holes, then guess what? Yes, they will help you, but you're going to have to take them and take a lot of them for the rest of your life. Okay? Let's talk about the chemical, sleep. How much sleep should you get? Women, 8 to 9 hours. Men, at least 7. Okay? When should you get your sleep? Yeah, at night. This is why a lot of people who work a night shift and sleep during the day, why their circadian, their cortisol levels are so out of whack. You should get a majority of your sleep, so over 50% of your sleep before 2 a.m. Okay? How do you prepare for sleep? How do you prepare for it? So sleep should be an event that you prepare for. That means that no blue light. That means no computer, no television, nothing that is emitting a blue light for at least an hour before you go to bed. As soon as you're having screen time, phone, I actually have a blue light blocker on my phone that I set after 5 o'clock so that I can if I look at my phone or anything, the cortisol levels won't spike back up because it's making me more awake. But if you are, like, one of the worst things you can do for your sleep is just lay in bed and scroll through your phone or go onto the computer. So at least an hour you shut off all electronic devices. What kind of environment should you sleep in? It should be cold, and it should be completely dark. Meaning no light from your phone, no night lights, no lamps, nothing. It should be as dark as possible. And then people will ask me, like, what about caffeine? Okay, is caffeine okay? Well, you have to understand that probably a lot of you are reaching for the caffeine not out of enjoyment, but every time that you have caffeine, you're trying to boost what? Your cortisol levels. So if you keep trying to boost the cortisol and you're having 3 to 4 or 5 glasses of coffee, you got to figure out, why am I trying to keep boosting my cortisol levels? And instead, maybe I should actually work on what I'm doing to tank those levels. Because every time that you are having a lot of coffee and a lot of caffeine, you're forcing those adrenal glands to function, and do you think that over time they can become tired? Yes. Okay? All right. Now, let's talk about leaky gut too, how this affects the gut. Remember what happens when you're under stress? What happens to the gut? What happens to the digestive system? Digestion shuts down, okay? So here's what happens. When you have mental stress, toxins, like the biggest one's going to be Roundup or glyphosate, food particles, which we would actually call them undigested proteins, carbohydrates, and fats that will show up in food allergy testing, or drugs, like antibiotics, for example, or having infections, or having a liver gallbladder malfunction, something like a pancreas is not secreting enough digestive enzymes. What happens is this will cause inflammation of your GI system. So when you look at your gastrointestinal system, if you look at layers of skin or layers of cells on your skin, there's about 5 layers and they're lined up on the skin like this. In your gastrointestinal system, your stomach and large intestine, there's 1 layer. That's all there is. 1 layer that separates the outer environment to the internal environment, where the blood and the immune system and everything is. 1 layer, that's all it is. And when you assault that with all of these different things, that layer of cells can start to spread apart. And now what happens is all of that stuff starts to leak through, and this is called intolerance. It's not intolerance, it's an allergy. An allergy requires an immune system reaction. And anytime the immune system reaction takes place, there has to be inflammation. And then what happens is this develops immune system issues and can lead to autoimmunity. And every person who has autoimmunity, when we do a food test, guess how many food allergies they have? 25 to 30. So, how many people get a lot of sinus issues, they get a lot of allergic reactions, seasonal allergies, things like that? You have something that's most likely called leaky gut. And you have a lot of foods that are leaking into your bloodstream that the immune system says you don't belong there. And it's going to cause a lot of inflammation. Okay? So, food allergies. I always tell people, get a food allergy test, but if you're unwilling to do a food allergy test, guess what? Avoid wheat, avoid grains, avoid dairy, avoid corn, and avoid soy. Avoid those 5 foods like the plague. Then get your food allergy test, and then we'll work on some of these other ones. But most people, this is why. Wheat has gluten. Gluten damages the gastrointestinal system. Grains, glyphosate, that's Roundup. That will poke holes in the gastrointestinal system. Dairy has casein. How many people do we have that has an allergy to casein? Almost every single person, which actually leads me to believe that you're never supposed to have milk or cheese that come from a cow. And then corn will also have glyphosate, and then soy. Soy is going to have glyphosate. It's going to have, the Roundup is what it's called. But soy will decrease thyroid output. And the only time I recommend soy to people, if they have hyperthyroidism, I'm like, have some soy milk, and that will bring your levels down until we can figure out what that is. All right? So gluten or wheat, grains, dairy, corn, and soy. So this is actually someone who does have some autoimmune type conditions that are going on. You can see all the different immune system reactions that they're having to all of these different foods. But here's one of the reasons or things that you need to know if you need to get your food allergies test. Child has earaches all the time. Guess what? They need to get their food allergies tested. Mood swings, anxiety, aggressiveness, irritability, fatigue. How about dark circles under the eyes? How many people wake up and you're puffy and dark circles under your eyes and you think that you need more L'Oreal to put underneath it? Asthma. How about canker sores? You see children having a lot of unexplained canker sores? My son was getting canker sores all the time. Guess what we did? Checked his foods, removed the foods, and guess what happened? No more canker sores. How about sinus problems? How about acne, eczema, brain fog, bloating, excess weight? How many of you eat something and you're like, my gosh, you just gained 8 pounds? I gained 8 pounds of fat. No, you gained 8 pounds of swelling, which is water and inflammation around your gastrointestinal system and headaches and migraines. So I had a guy, we tested his foods, reacting violently to things like casein and milk and eggs, and was having headaches every time he worked out. He said, I thought it was normal for me to have a migraine headache after I worked out. He removed those foods, and guess what? Doesn't have migraine headaches after he works out again. All right? It's pretty cool. And then when you start to affect leaky gut, you start to affect your colon. So this is actually a poop test. So you measure your poop when you look at this. So you can see that his microbiome is getting knocked down. He's getting an overgrowth of some of the other bacteria that are growing in through there. And do you know what those bacteria actually do within your colon? They contribute to a lot of things, including the production of serotonin. And you know what serotonin is? That's your happy hormone. That's involved with mood, and that's involved with sleep. And when you look at it, about 80 to 85% of it is made in the gut. So if your gut is unhealthy because you're stressed all the time, then you're going to interfere with the production of serotonin. Yet when someone's depressed, how many people are actually looking at physical chemical causes? Are there mental causes to depression? I believe so, absolutely. But remember, all disease is what? It's multifactorial. There's never one thing that causes it. You have to address all three. And what about the connection between the spine and the brain? Is there a connection between stress and what happens in the spine and brain? Raise your hand if you worked on correcting your spine and nerve system and you started digesting your food better and you started sleeping better. When that happens. There you go. And people said, am I crazy? Why is that? Because we're removing a huge stressor from someone's life. A huge stressor from their nerve system. Physical stress can be one of the biggest things that can drive down the nerve system and then cause issues with stress hormones. Now, chronic whiplash injuries. This is why people can get very sick after they've had a trauma to the spine and the nerve system. When you have a chronic whiplash injury, here's what happens. This and then this, and you damage the brainstem, the spinal cord, and you damage the neck, then what happens is it will affect the function of cortisol inside of the body. They start to have cortisol rhythm problems, cortisol rhythm issues. But how many times when I say, have you been in a car accident? Yeah, but it was 5 years ago. Yeah, but it was 7 years ago. And I'm like, even worse, because you never fixed it. And now you've been driving those cortisol rhythm to be abnormal for such a low period of time. This is what can happen after a whiplash injury. This is Lissa. This was her first x-ray. If you look at this from the side, right here, this is her, and then this is normal. Here's her eyes and her teeth. You see what was happening to her neck? Basically, you do this and you pull on it. Her whole spinal cord was getting so severely stretched, her brain thought that she was getting hung, like there was a noose around her neck, so much pressure. So she had problems losing weight, severe depression, couldn't sleep. This is actually an x-ray after about 6 weeks, and you can see how it reversed that. And what did she say? She said, I'm losing weight, I'm sleeping better, and I'm digesting foods, and I am happier. So what did we do? We took a major stressor off of the physical part of her body. You guys ever heard of the vagus nerve? I made this look bad on purpose. This is called the vagus nerve. So the vagus nerve sits up here. This is why people have, when they have neck issues, how they have so many problems with vagal nerve function, because look at what the vagus nerve that goes from here in the upper part of the neck, and it goes and affects what? Digestion. It affects the lungs. It affects the heart. It affects the function of the liver, the pancreas. It affects everything inside the body. It's responsible for slowing it down and for calming it down. And if that nerve has get damaged, then what predominates? Fight or flight. Yep. So the vagus nerve does this over here. It stimulates activity of the stomach. It inhibits the release of glucose, stimulates the gallbladder, stimulates activity of the intestines. This is why with babies, when we correct the upper part of their neck, what do? Almost immediately, they poop their pants. In a good way. So I, for a while, was known as I was to go to Dr. Nate. If your baby needs to poop, go to Dr. Nate. But if the sympathetic nerve system is overriding it, it inhibits the activity of the stomach. So you don't secrete stomach acid. And if you don't secrete stomach acid, you're not going to digest your proteins. Your gallbladder isn't going to work the way that it's supposed to, and your intestines aren't going to work. And you're setting yourself up for an absolute recipe for disaster to eventually actually causing things like digestive type issues. You lose your healthy microbiome. You stop making serotonin. And then you think it affects your hormones and everything after that. Yeah, because your hormones are responding. They're not causing anything. They're responding to what's happening inside of the body. Make sense? So if you got physical stress, how about chronic pain, fibromyalgia, neck pain, headaches, numbness, burning, tingling, thyroid issues? All of these things that we go over and through here, all of those, there's a physical component to it, which means that any kind of health issue that you have to address the what? The physical, the mental, and the what? The chemical. You have to start addressing all three. And if you address all the three, then you are sitting on the stool of health. But most people can't figure out why they can't get better because they're wobbling on one. They're saying, well, I'm going to go home and I'm going to apply the 5x5 rule. Yep, that's going to help you, but you always have to, one of your priorities really should be my health. And I'm going to do something today to move my health forward. Even if you're only spending 5 or 10 minutes. Some days you may spend 2 hours. But if you work on your health as your priority every single day, you're not going to wake up and you're going to say 5 years later and say, what happened? You're not going to be caught with the proverbial, your pants down, because you've been working on it every single day. And people ask me, they say, well, how did you write a book? How did you do this? And I say, I tell you that because I'm no better than you. It was a priority that I worked on what? Every single day. Some days it was 15 minutes, some days it was 4 hours. It just depended on the day, but I worked on it every single day. And if you work on it every single day and you refuse to negotiate your priorities, then you give it a year, you give it 2 years, you have no idea how much better you can become. But most people are what? Impatient. I'll give it a week. Nah, it didn't work for me. You have to be patient. And it has to be a priority. And you have to be willing to just do the small things, the boring things, the mundane things over and over and over. And then you wake up and you're like, my goodness, I have my health. But it happens much slower than what a lot of people are actually willing to do. All right, what's next? Hey, if you're a guest here, thank you very much for being here. I love you already. If you say, hey, I'm a guest here, where do I need to start? I want you to talk to Leanne, and she'll schedule you for your first visit. Your first visit, there's going to be basically a consultation and exam with me. And if you have any kind of health issues, any kind of challenges whatsoever, what I want you to do is if you can get your past test results, like up to a year, I'll go ahead and I'll be able to look at those, and I want you to fill out what's known as an FAQ, Functional Assessment Questionnaire. How many of you have filled that out before? A lot of questions, yes, I know, but it helps me a lot to see what the organs that are under a lot of stress. And then we'll have a consultation, we'll do an exam, we'll take some needed x-rays. This includes actually analyzing what's happening neurologically, but what's happening chemically in the gastrointestinal system. Because when we actually measure your x-rays, we open it up and we see all of this gas and things like this I showed you, you got a lot of gas in there. You got a lot of gastrointestinal inflammation. And so, and then what we'll do is I'll go over with you, what we found, and then what we need to do from a chemical, mental, physical standpoint in order to work on getting you better. All right? And if that's you, if you're like, I want to get better, okay, and schedule an appointment. Actually, I don't like broccoli. But if you're someone who says, you know what, I'm at a point where I'm sick of being sick, and I'm ready come hell or high water to do something about it, then go ahead and see Leanne, and she'll help you through it. If you're a patient here, you're like, I need to get back on track. Dr. Nate, where do I start? Just ask Kelly. She'll schedule a consultation with you, and we'll be happy to help you, help you figure out where you need to go, obviously, from here. But when we do consultations, we spend 20, 25 minutes going over everything with you and say, hey, here's where we need to head. And if you're that person that wants to head in a new direction, just ask Kelly, and she'll help you with it. Any of you you want to take home some kava or California poppy or CBD oil, let them know too, and they'll help you with it. All right? So guys, thank you very much for being here. I got into it way more than I thought I would, so I appreciate your patience, all right? And have a good rest of your day.